There we go. So this morning we are joined by Choli Boland, who is the Chief Executive Officer for the Winchester District Memorial Hospital. And just like all other hospitals, they offer so many more services than just the emergency room that we are so familiar with. And so we've enjoyed it. We've invited Choli this morning to share with us their services. So you have access to share your screen. The floor is yours. Welcome.
Hey, thank you very much. Thank you for the opportunity. Welcome, everyone. So it gives me great pleasure to be able to tell you a little bit about WDMH. Just warning, we're very proud of the work we do here. So I'll do a fair amount of boasting, but I'll tell you about our services and some of the other things we do. So the first thing to do is try and take care of the technical part here. So can you see this PowerPoint?
No, I just see like your home screen,
All right.
like a blue spirally thing.
Right.
Do you have double screens?
I do, but I
Yes.
wasn't using them because it's not always doesn't always work. Let's try this again. Bear with me.
Not a problem. So we now see your presentation, but we also see it as the presenter view. So we see like the next slide and where notes would be.
We're a little beyond my technical expertise.
Like we can still see everything. I think that's not a problem.
Try and start over.
All right. So maybe unshare your screen.
That's what I'm trying to do, and it's not like I've never done this before, but I've lost all my buttons.
The other option is if you want to just quickly send this to me in an email, I can share it for you and move ahead. You just have to tell me next slide and I can take care of that for you.
So, try one more thing.
I think I can stop you from sharing if you'd like me to try that.
Okay, try that.
There we go. So we're back to the.
All right. Let's try one more time.
All right. This looks good so far.
Okay.
And I think if you just click there. Perfect.
All right. Okay. So you can see my slideshow.
I do, yeah.
Do you see me at all? Like in the corner?
I've made you the spotlight for everybody so that everyone should see your slide and you as well.
Okay, all right. I just want to know if okay. Here we go. So let me tell you a bit about Winchester District Memorial Hospital. This slide has, you can see the phrase compassionate excellence. That's what we're all about. And I'll talk a bit more about that in a minute. First of all, let's talk about where we are. We're the Winchester District Memorial Hospital. You know, I know that most patients don't look at lines on a map to decide where they're going to go to a hospital, but this is just roughly our our service areas. So you can see Winchester's here. To the left, to the west is Highway 416, and Kemptville would be over here. To the south is the St. Lawrence. To the east, we roughly go to Highway 138, just this side of Cornwall. And up at the north is a series of roads that would define much of our catchment area. So, and I'm sure if you're from this area, you know that there's many, many more small communities within this outline that are depicted here. But we have two demographics in terms of our service area. We've got the south here, our traditional service area, SD&G. We know from general statistics and from our own research, this is an older population. It's a typical rural population, characterized when it comes to medical care and health challenges by a lot of chronic illness, heart, lungs, diabetes. We're well aware of the incidence of smoking in our area, in our communities, unfortunately. So we have a high incidence of lung cancer also. Tends to be older, a lot of pioneers and farmers, very hard workers, but also tend to be somewhat overweight. So we see that type of complication in a lot of people who come to us. So these folks are coming to us on a regular basis, seeing their doctors. Up in the north, Osgood, the southern sprawl of Ottawa, it's a different demographic. It's a fast-changing, growing area, significantly younger in terms of average age. They come to the hospital maybe for day surgery, to have a baby, that type of thing. So it's really two different demographics, defined a little bit by municipalities, but we're here to serve everyone, and that's the district. And we have people coming from further away depending on the specialty. So everything we do is defined by our commitment, and most organizations have mission, vision, and values. This is our version of that, and you can read it as well as I can. The phrase "close to home" is something I'll repeat throughout my presentation, as well as partners and partnership. We pursue excellence, and I'll give you a lot of evidence of that we continue to pursue excellence. And you can see our list of values. Notably, we are one team. That's a very common phrase around the hospital. When we put this together, we had a group of patients, of staff, of physicians. And one of our long-serving physicians who've been here more than 40 years said the very best of WDMH can be summed up in two words: compassionate excellence. So that's kind of our catchphrase, and that's why I started the presentation. So we'll go on in different dimensions of our commitment, and first talk about as much hospital care as close to home as we can provide. I'm not going to list and tell you about all of our services. We don't have time, but I'll highlight some things. We have a very comprehensive surgical program. We've got 3 surgical theaters that run, electives and non-electives throughout the day, and we're on call 24/7 for after-hours surgery. We have general surgery, gynecological surgery, plastic surgery, ear, nose, throat, urological, ophthalmology. We do not have orthopedics. We've got Kemptville, that's 20 minutes away. Cornwall Hospital, that's 40 minutes away. They're both do orthopedics, so it would be a lot of duplication if we were to do that. We have a maternity program. Back when data was out from the government and NRC Picker that actually ranked maternity programs in Ontario, they don't do that anymore. We were ranked #1 among all maternity programs in Ontario. We have all the expertise of obstetricians, family physicians, incredibly highly trained nursing staff, and midwives who deliver anywhere between 600 to 800 babies a year, which is small by comparison to urban centers, but obviously very vital to our communities. And we have all these expertise, the latest technology, and a very small town, very positive atmosphere feel. So our maternity program is very popular. We have regional programs in partnership with the Ottawa hospitals. We have a dialysis program for people whose kidneys don't function properly and have to come to the hospital to be dialyzed, basically have their blood cleaned 3 times a week for their entire life. So very important for that service to be close to home. Similarly, we have a chemotherapy program in partnership with the Ottawa Hospital for people who are unfortunately diagnosed with cancer, and again, have to come in very regularly to get chemotherapy and can get that service close to home. We have a sleep lab, and there used to be one in Cornwall. I believe it's closed down, so there's us, and then you have to go into the city if you want to access sleep lab for people with obviously sleeping difficulties, difficulty breathing at night, sleep apnea, that kind of thing. And the great thing is we can use hospital facilities at night when often it's not being used. So we have that. Something that's not that common is we have a cancer coach. So this is the result of some fundraising by some cancer survivors in our community. And when someone's diagnosed with cancer, there's obviously a lot of medical, a lot of technical therapy and services available, whether it's chemotherapy, radiation, working with your doctor. The cancer coach tries to work much more holistically and looks at things like exercise and counseling and nutrition and try and fills in the gaps that maybe the formal medical system doesn't address. So that's something that's very important to our patients. We have just implemented the provincial lung screening program, and I think there's very few in Eastern Ontario. We're 1 of 2 or 3, and that's again a government-sanctioned, government-funded program to try and detect ahead of time people with lung cancer or predisposition to lung cancer. And before the end of the year, I guess in the respiratory sense, we'll be implementing pulmonary function testing, which obviously assesses lung function, helps to distinguish if someone's got a condition, whether it's the problem is the lungs or the heart. Again, something that's not too common, will be done on a note basis and will be a new service for us. Rehab program, our cardiac reprogram, is something of interest because several years ago, we kind of did a statistical analysis of people who in our area, in our service area, who'd had a cardiac event. And we found out surprisingly that more than 60% of the people who'd been referred to the Ottawa Heart Institute for follow-up rehabilitation program, and this is something that's pretty important, it's your heart, it's to get you repaired with one of the best institutions in the world, 60% of people didn't bother making that trip into Ottawa, whether it was cost or just the difficulty, the inconvenience. So we partnered with the Ottawa Heart Institute, and we now have a very similar program, again, in partnership with them at WDMH. So people don't have to go through that real or perceived barrier into the city if they've had a cardiac event, and they can receive rehab services here, as I said, close to home. One other thing that's not too high profile, nor should it be, is pretty much since the inception of the legislation, we have offered medical assistance in dying. I've never been present for something like this, but the physicians and nurses who do and have done this tell me it's one of the most difficult things they've ever done in their career, and at the same time, one of the most fulfilling things. So it's obviously a very important service, low profile to anyone around here in our service area. And then just to go through, I won't read off all our other services. We have many specialties here. Mentioned all the different surgeries. We don't have a per se inpatient rehabilitation unit. We have a lot of outpatient rehabilitation. We also have an Ontario breast screening program and a couple services that you might not be familiar with. We have something called restorative care, and that's largely targeted to seniors who are struggling to thrive in wherever they're living, possibly living on their own, and just a matter of this is a LHIN-funded, LHIN-sanctioned program that those people can come into hospital for 3, 4, 5, 6 days, make sure their meds are stabilized, make sure they're under doctor's care, make sure they're seen in terms of any rehabilitation issues, and just basically assessed and try and get a kind of a shot in the arm, figuratively speaking, get back on their feet. So it's something we've been doing for 4 or 5 years. And then similarly, we have a deprescribing program. You're probably familiar with, typically seniors may have a large number of medications that were all added incrementally for very good reasons, and yet they're maybe working at cross purposes. And you can't just remove medications willy-nilly, because obviously there's side effects, there's impacts, there's withdrawal impacts. So a lot of this has to be done under supervision. So we have a deprescribing program where someone gets admitted and this happens. And we've had truly remarkable results where people, for example, were on 30, 35 medications, and that was reduced to something like 12. So it's a very productive service. I don't know if you can see it, but one of our staff members just wrote a book on deprescribing and published it. It just came out last month. So it's something, again, very few services like this in Eastern Ontario, and this is available at WDMH. So moving on, just some stats. What did we do last year? We did about 4,000 surgeries. Only about 10% of those are done where people actually spend the night in the hospital. And as I say, almost 90% are day surgeries where someone comes in the morning, sometime during the day, they have their procedure, they recover, they get stabilized, and they get sent home for the night. Our ER visits are down a little bit because of the impact of COVID at the beginning of last fiscal year, but we're small by any standards in terms of an emergency department. We're staffed proportionally. So that's something, and then with any ER, I'm sure you're aware that it's not first come, first serve. It's based on triage, and depending on the day, the time, and the number of people, waits can be long or short, and that's just the nature of ER. Last year, again, we were down in terms of babies being delivered. We're projecting probably about 700 going to be delivered this year, and as I say, typically it's between somewhere 650 and 800. We have our chemotherapy, diagnostic imaging, and our outpatient visits. Interestingly, before the pandemic, we had about 30,000 ambulatory care visits a year. And those are outpatient clinics with specialists and that type of thing. And the result, I think, to everyone's benefit of the pandemic was a lot of those went virtual. And there was no need, for the physician to come to the hospital, and likewise for the patient to come to the hospital. There are still, obviously, lots of opportunities, lots of reasons for someone to come for an actual personal visit, but that's declined certainly since the pandemic. And then every hospital in Ontario has an arm's length, an outside firm that does surveys of their patients. That's all changed recently from one company to another, and this is data from the last company, but we do pretty well. We're very, very proud when we talk about, pursuing excellence at WDMH. These are the results of our patient satisfaction surveys. And, they typically range from 95% to 100%. So we're under absolutely no delusion that even if it says 100%, we're in any way perfect. We can always improve. We do get complaints. We do make mistakes. We're all human. But certainly in the eyes of the people that we serve, we're doing very, very well. And we're very proud of that. Some other things, when Accreditation Canada comes through, we always get their highest award, exemplary standing. We've done that twice in the last 8 years. And a lot of other things that we track, we have really good quality. If something is supposed to be high, like hand hygiene or medication reconciliation, we do that well. If something is supposed to be low, like readmissions or infectious outbreaks, that's low. We have not had an infectious outbreak inside the hospital, even through the pandemic, for about 10 years. We've not had any type of outbreak of COVID or C. difficile or MRSA or any of those. So we're very proud of that. We actually, as a satellite, Cancer Care Ontario, the former, told us we have the largest cancer satellite in Ontario. So that means we get a lot of practice at providing this type of therapy. So you can expect a standard here on a par with anywhere else in Ontario. Every year we get pharmacy accredited, like most hospitals do. And we have a lot of involvement with our patients and families. So I'll tell you a little bit more about that. We have something called PFEP, which of course is the acronym, and that's our Patient Family Engagement Committee. So this group of patients and families provides input on everything we do. You know, we always thought historically that we knew what was best for the patient, and based on experience, we knew a little bit of that, but we don't really know that from the patient perspective. So they provide everything feedback to us on especially communication materials that go to patients, developing policies, developing programs. We've got them on all our planning committees. We've got patient or family representative when we're recruiting managers or even medical chiefs. We've got patients there, and they participate. You know, everything gets run by PFEC, our quality plan, our budget, our priorities for the year, our priorities in a strategic plan. So certainly much more so than historically, our patients and families are involved in guiding us on what we do to make sure it's as effective for them as possible. And then we have what I call the seed of approval. Certainly from a clinical perspective, no matter what the service, there's somebody somewhere outside coming in to do an inspection, an accreditation, a review, you name it. Last year, our laboratory was accredited. Every year, our pharmacy is. We're just in the midst of having our family medicine residency program accredited. And of course, as I mentioned, Accreditation Canada looks at the whole hospital. We've done very well with them. So let me tell you about some of our partners. So here's a depiction of the hospital campus. And on the left here, we have the hospital. And on the right, we have Dundas Manor Long-Term Care Home. If you can't see so much the distance between, it's about 150 feet between the two organizations. And if you live in this community, you probably think the hospital owns Dundas Manor, which is not true. It's not accurate, but that's just a common belief. So let me just tell you, we've got the hospital here on the left and Dundas Manor on the right. That's owned by a company called RHI. And they are separate organizations, separate corporations run by separate parts of the government, separate. But because we have a relationship, there's a management agreement between the hospital and Dundas Manor, and they purchase services of myself and two other executives. And that's the formal legal part of this. But we are 150 feet from each other, and we work very, very closely together. We have a common motivation to have seniors thrive, whether it's in the hospital, Dundas Manor, or in the community. So we share knowledge when it comes to falls, wound care, infection control. We share education. We share social activities. We share planning. We also have the same physicians that work at Dundas Manor working in the hospital, which is great for continuity. And also we'll be building a new manor, so we've got a single fundraising foundation for it too. So if you come around here, it looks like Dundas Manor is part of the hospital. It isn't more formally than what I've just described. And maybe I'll come back in sometime in the future and talk about you solely about Dundas Manor long-term care home. We'll continue on now with the hospital. Obviously, all of us in healthcare, partnerships are very important. And we have something, I've got Health Hub here because that's what the last government called these types of things. You can call it a health hub, a center of excellence, a campus of care, but we've got a whole lot of things, services on our campus here at Winchester that we're trying to work together for the sake of the people we serve. We've got the hospital as well as Dundas Manor, and you've seen how we're connected. We've got two buildings, which we call community care buildings. You might call them medical buildings or clinical buildings, where essentially all the healthcare and social services in this area are located in one of these buildings. And everything from the health unit to home care. We've got mental health services, some physicians' offices, private physio, audiology, that type of thing. So we're all within a few hundred feet. We try to work together. For example, if someone's in the hospital and they need some sort of vaccination, they can get referred across the parking lot to the health unit. So we've worked a lot with these people. And then we have at WDMH, we have a data center, a computer center that looks like it supports the hospital, but actually supports a lot of Eastern Ontario. All the laboratory information in all the hospitals in Eastern Ontario are stored at the WDMH data center. There's two big applications that physicians use: e-consult, e-referral. The bits and bytes and technical parts of that are stored at WDMH. And as well, we have an incident reporting system, as an example, we share for 11 different hospitals. So behind the scenes, we've got a lot of connections. And then, of course, we've got other types of integration. I've talked to you about dialysis, oncology we have with the Ottawa Hospital. Diagnostic imaging, when it comes to the computer piece of X-ray images and all other images, we share a system with the Ottawa Hospital. We are also managing a system of diagnostic imaging and those computer images that is shared by WDMH, Almont Hospital, and Arnprior Hospital, and the Royal Ottawa Hospital. So we've got, again, those connections a little bit behind the scene, but we facilitate the management of those images that are so important in diagnosis. You may have heard of this because we talked a lot about it over the last year and a half. About a year ago, we implemented the EPIC clinical information system, a computer system with all our patients' information system in it. So it's a computer system. What's the big deal? Well, it actually connected us to 6 other hospitals, including the Ottawa Hospital and the Heart Institute, which are where we send, if we're going to transfer patients out, that's typically where we transfer them out. And one of the big benefits of being part of this EPIC network is if we transfer someone to the Ottawa Hospital or vice versa, people at each end, doctors, nurses, therapists, see the identical patient information. That used to be a real concerning handoff when you go from one hospital to the other, because there was always some shortage of information you were transferring, and that doesn't exist now. Also with EPIC, our patients can go on through My-Chart and see all their clinics. They basically see their medical chart online and be much more informed that way if they choose to like that. IRLA is the regional laboratory system. All hospital laboratories are part of a single organization called IRLA. WDMH is part of that. And as I mentioned, we've actually got all their data here in our computer department. We are part of a regional ethics program. We actually have a single ethics function between the hospital and Dundas Manor, and both organizations are part of the Champlain Regional Ethics Network. And then, of course, there's our Ontario Health Team, the Great River, which was a result, call it a merger between the Cornwall and Area Health Team and the Upper Canada Health Team, which was Winchester and surrounding areas. So we're making a lot of progress with that. One of the trickiest questions I always get is how many people work at the hospital? So depends. If you're talking about salaried staff, we've probably got almost 400. We've got largely doctors in this number. We've actually got just a couple of dentists and I think 8 or 9 midwives. So that's quite a few people contributing to that. We had actually a couple hundred volunteers before the pandemic, and sadly the pandemic prevented many from coming back. So we're looking for more volunteers, but we're so blessed with these 77 or 80 that we have now that do so much for the hospital. And then we have trainees, we have students, we have medical students, volunteers, nursing students, pharmacy students, physiotherapy students, laboratory students, health record students, even administrative students. So we have all of those coming through our hospital over the course of the year. And in addition to clinical work and all of that entails, we do teach and research. So we have a teaching program. I've made reference to it several times. We are a teaching hospital. We have a family medicine residency where physicians kind of in training who are finished their degree come for 2 years and do their entire postgraduate training here. So typically we have 4 to 6 of those. 2 or 3 come open every year, and we have about 250 people from across Canada applying for those 2 or 3 spots. We also have specialists, other people who are in other types of residency, general internal medicine, obstetrics, that type of thing, come through rotations. We have lots of these people coming through, and most of our physicians have academic appointments at the University of Ottawa. We also have a research program, and if you've ever had the opportunity to read a research journal and really wanted to do that, you'll notice that most of the research studies are done in cities. We do something different. We look at rural research, and that's very much our mandate. So we do clinical trials, we do drug trials in the areas, conditions like COPD, heart failure, asthma, but we also do rural studies. For example, how do you best prepare someone from surgery in a rural hospital? Catheterization in a rural hospital, reducing delirium in a rural hospital, because in a rural hospital with many fewer services than in the Ottawa hospital, where lots of research is done, it's a very different process. So we teach and do research, and the question is why? Well, teaching is great because, tell you one thing, we get first crack at new graduates in terms of working here. If they've already worked here, we've done an audition for both of us. So a lot of people who work here now started off as students, but also having these students come in, that's new blood, new energy, keeps you on your toes and helps advance our agenda, pursuing excellence. Likewise with research, if we're doing we look at a question and we find out we're doing it well, we'll publish and tell the world. And if we're not doing it well, we'll figure out how better to do it, and we'll publish and tell the world. So teaching and research helps our clinical work, helps us pursue excellence in our clinical work. So all 3 of those activities are connected. And then, of course, like every organization, we have a strategic plan, which I won't go into detail, but I'll just give you some examples. We've got 4 main categories. The first one, of course, is all around patient experience and outcomes. And some of our activities of that is always, we've got a detailed quality plan where we pursue quality improvement in a lot of areas. This year, we're trying to reduce wait times. We've got special initiatives underway in the emergency department, in our diagnostic imaging, and in our surgical program. Another of our priorities is all about working with other organizations and acknowledging that a lot of the patients' healthcare experiences leaving the hospital. We actually have a really big research study underway called Transitions in Care, where we've partnered with 2 other rural hospitals and are examining how to best optimize patients' transitions out of a rural hospital. Again, very different than if you're transitioning out of a city hospital and live in a city. We are very, very fortunate at WDMH. We are pretty much fully staffed. We don't use agency staff, and we're very fortunate that our staff here is committed to working here. We don't take that for granted. We're always trying to improve the workplace. We have surveys, we have fun, but that's only a small part of it. This year, for example, all of us here, beginning with management, we're part of a course we're all taking online. It's by CMHA, and it's teaching us all how to better make our workplace as psychologically safe and appealing as possible. And we've just started into that, and we're learning a lot. So that's part of what we're doing to try and improve our workplace. And then our other category is all about accountability. I mean, part of that accountability last year was when we engaged in EPIC and implemented that to enhance our relationships for our patients with other hospitals. Another example we do with this is we have an environmental stewardship committee who's looking at as many things as possible as we can to reduce our footprint and make us more environmentally conscious. So those are just some examples in our strategic plan. So looking ahead, we're always trying to add services, more care close to home. We'll be dermatologist is going to start working here in the next few months, also rheumatologists. And hopefully in the next couple of years, we're looking to implement an MRI, here to save our patients from having to travel elsewhere to do that, more care close to home. In general, we're going to continue as a full service hospital, both with our clinical service, our teaching and research, and always looking at that compassionate excellence, compassionate care. We don't do it alone. We're all about our partnerships, and especially our Great River Ontario Health Team that the government is putting a lot of emphasis on, and we look forward to playing our role and helping move those things forward. So that's WDMH. Going back to our commitment statement, we are one team. And if you notice down here in the lower right, this is a picture from our annual staff versus physicians hockey game. And I'm just sad to report to you that every year there's always one or two medical students who play junior hockey. So the staff never even come close to winning this game. But anyway, we do have fun here. And just wondering if there's any questions. I'll stop sharing.
Jolie, that was fantastic. It's truly a full service hospital. I personally have learned quite a bit this morning. What a great presentation. Thank you so much. So opening it up to questions. Does anybody with us have questions this morning or comments? There is a question in the chat. Do you have geriatric day programs?
No, we don't as such. Our geriatric program is twofold. We have a clinic and we have a geriatrician who consults with our inpatients. So at this point, that's actually a good point. We may pursue that. I appreciate that.
Great. And then just a comment, a great presentation indeed from Jason in the chat. Any other questions this morning?
Yes.
Phyllis, go ahead.
Just one question. Is the hospital connected in any way? I missed the very first part, through the community support sector, connected with Care For and other day programs? Do you coordinate any medical appointments with transportation services in the community?
So it all depends what you mean by connected. We're not formally connected. Our discharge planners would have relationships and interact with all those services. So that would be the degree we do. So we are, I'll tell you something else. People may be familiar with the term ALC. It's alternate level of care. These are patients that come into the hospital for treatment and stay here because there's no place for them to go effectively somewhere else. It's the number one challenge in Ontario hospitals. WDMH undertook about 8 years ago quite an effort to reorient our approach to ALC patients. And we have very few, we have the fewest in Ontario. The reason I bring that up now, it's because we have very, very strong relationships with community services, retirement homes, that kind of thing. So, so that would be my response to your question.
Okay.
I am muted. There we go.
Whoever has a question or a suggestion, feel free to pick up the phone and send me an email. Love to talk to you.
Absolutely. And I will share your contacts when I share the recording with everybody. And I just wanted to mention one thing, Jolie, if you are looking to recruit more volunteers, if you have a volunteer coordinator on staff, please connect them with us. We have a volunteer administrators network that Phyllis is part of. And so we'd be happy to support in that capacity as well. We have a volunteer email list that we share postings with on a regular basis. So if you're still looking to recruit, we can try to support a little bit in that capacity. And one more question in the chat: will there be a list provided of all the services? Oh, I guess I
will send that to you as soon as we get off this.
Perfect. And so I will include. Excellent. I'll include that with the link in the email that goes out to everybody.
Okay.
Wonderful. Last call for questions. Great. Well, I want to thank you for such a thorough presentation this morning, Jolie, and for joining us and for caring so deeply for your hospital and your staff and your patients and sharing that passion with us this morning.
Okay. Thank you very much. Thank you all.
Thank you. Have a good day, everybody. Bye.